Hi everyone. We get many inquiries on how Chinese pulse diagnosis works, specifically my method, which is called MPD, or medical pulse diagnosis. And what we'll have is we'll have a young man come in today and we'll take a look at his pulse and I'll tell you exactly everything I see in the pulse. And I'll give you an idea of how this method works. So go ahead and sit down and let's take a peek, okay? All right, so the first thing we do is we take a look at the right arm. And the positions are called Sun Guan Chi. They're right in this area, Sun Guan Chi, okay? So his Sun pulse is too deep and he has a little bit of strength. What that means is there's inflammation in his sinuses. He has sinus sort of problems. He could have a deviated septum, could snore, or just there's phlegm retention in his sinuses. To be healthy, that's got to be cleaned out, okay? That's from the Sun. Now let's move on to the right Guan, which tells us the condition of his stomach and pancreas. And in this case, it's normal. It's in the middle position, middle depth. It's not too strong, it's not too weak. So I would say his digestion is pretty good. Then the right Chi, there's a little short pulse in the right Chi position, means that there's a little bit of soft tissue damage in his shoulder. It's not much, but it's there. And his neck and upper back are stiff. And the stiffness in the neck and upper back seems to be more muscular, not really spinal damage. Okay, let's take the left. Now the left Sun pulse is related to the small intestine and the functioning of the heart and the pericardium. And this is a young man, so we wouldn't expect anything to be problematic. Do you get overly anxious?
Maybe sometimes.
The blood flow into his heart wall could be better than it is. Sometimes this is produced by trauma. Well, in Chinese medicine, we would treat this, and we would use herbs. The simplest is a formula called Zhui Fu Zhu Yu Tong to open up blood flow into the heart area. How will it affect him? He'll notice that he's less anxious. His left Chi pulse, there's a short pulse in the left Chi position that looks like he's had soft tissue damage in his knee, and then his proximal pulse beyond the Chi position is hard to feel. There's a lot of stiffness in the lower back, legs. So if he came to the clinic and he complained about his lower back, knees, legs, the formulation would be strong blood movers with a little bit of anti-inflammatories. That's how the formula would be developed. As for his sinuses, we would use herbs that are anti-inflammatory for the sinus tissue to de-swell it, and we'd use herbs to take any kind of gooey phlegm out of the sinuses. That's exactly what we would do. So that gives you an example of how medical pulse diagnosis works. You can go to my bio, click on the link, and make an appointment with the Acupuncture and Wellness Center.